Welcome back to Across Louisiana. Well, besides you, the parents out there of Baton Rouge, they're responsible for feeding many of your kids. It's the East Baton Rouge Food Program within the East Baton Rouge Parish School Systems, and they've got some exciting changes coming up. Here to tell us all about that and more is Nadine Mann. Welcome to the show, Nadine.
Thank you.
Obviously people don't realize that sometimes this is where the kids get the majority of their meals. You got a lot of hungry mouths to feed, like all of us out there. So tell me a little bit about the impact of the food program in East Baton Rouge Parish schools.
Certainly. We have breakfast, lunch, and we also offer a supper program at many of our schools, but breakfast across the district in 85 sites. We serve 18,000 students each morning in 20 minutes. Wow. So we're the fastest food place there is in town. At lunch, we serve about 35,000 students across the district.
It goes without saying that's really a vital function. I mean, not just for the well-being of the kids, but it's really key to their learning, isn't it?
Yes, it is. Our food program is like a learning laboratory for the cafeteria. The students learn to eat breakfast each day because we actually have that for them. And then they learn to drink milk twice a day and the importance of having fruits and vegetables with their lunch and breakfast each day. And certainly how to eat, and that they should eat whole grain breads and different products. So those are all important.
Really, I mean, they're just from getting some daily sustenance there, they get to learn about nutrition and about, forming some healthy eating habits that will last them a lifetime, right?
That is true. And this year we're really excited because there's a new program that has become available to us. 3 years ago, a program called Community Eligibility Provision was piloted in 11 states, and this year it's now open to all districts that qualify across the United States, and we've jumped on it right away. So if a school district or school or group of schools is 40% or greater at risk or high poverty level, then that school is eligible. And I have chosen to group all of our schools together so that every child in East Baton Rouge Parish and the 3 charter schools that we service will be given a breakfast and lunch at no charge to the parent, which will be great because it will save the parents hundreds of dollars per child, and it will make it easy and fast for the kids to get their meal.
Absolutely, and we know that here in the Baton Rouge area, in some parts of town, food scarcity can be an issue, and it's really just so key for those kids to get that good nutritious food and get them learning right away, right?
It is, and there are places in town that don't have access to fresh fruits and vegetables, and we also offer a program called the Fresh Fruit and Vegetable Program, where 9 of our elementary schools are in a very high poverty area, and those kids are offered a fruit or vegetable 3 times a week, free of charge, and it is at a time other than at breakfast or lunch. So we're very excited to be part of that program too.
Obviously, with this making news recently, I mean, talk to me a little bit about some of the response that you've gotten. I'm sure lots of folks, this has got to be really great news for them, right?
Absolutely. Parents have been extremely receptive. It's just like textbooks or transportation. Now I'm able to offer to all of the children in EBR and the charters that we serve a free meal at no charge to the parents. So they are receptive, and we're looking forward to increasing those numbers that I told you about at first. At 35,000, I expect those numbers to go up at least 15%.
Wow.
Yeah.
Well, and that's a big difference right there coming out of it. Now, is this something that you're looking at as being a permanent fixture, or is this on a renewal basis, or how does that work?
We will be approved for 4 years, and then we can reapply at the end of 4 years. So usually when the USDA program comes out, it does become permanent, but for now it is every 4 years.
Fantastic. Well, full kids definitely learn better, and you're doing your part to take care of them as you do in their whole lives. So thanks so much for coming on and giving us a scoop on that. We look forward to seeing those numbers rise and seeing this program progress.
Great. Well, we're excited. And if a parent has any questions about it, they can look on our district website, the EBRschools.org, or contact us at 225-226-3604.
Fantastic. Thanks so much for coming on and telling us all about it.
Thank you.
Well, they're the first name in physical therapy here in the greater Baton Rouge area. It's Peak Performance Physical Therapy. Take a look, everyone.
At Peak Performance Physical Therapy, we're now starting our 15th year here in the Baton Rouge area. Of course, we're in Baton Rouge, Denham Springs, Brewley, and in Dutchtown, Geismar area as well. Started off as a single clinic back in 1999. We were over on Industrialplex Boulevard, where our main office still is located. And then we've grown slowly to kind of meet the needs of our patients and the physicians in the area. We treat a lot of athletes. We treat athletes from high schools to college to professional, but a lot of the athletes we treat are everyday weekend warriors, what we call. And recreation and sports as a recreational activity has exploded in the past few years, and in the time that we've been treating patients, a lot more people are now becoming more active and participating more in sports. So at Peak Performance, we're able to treat not only athletes that are in structured competition, but we treat a lot of people who just get out on the weekends and do a lot of things that just to have fun and to try to stay in shape. Physical therapists are known for putting their hands on people. It starts with our evaluation. It moves into our treatment strategies. We do joint mobilizations, we do stretching, which is kind of the therapeutic part of massage. We do ASTEM, which is a soft tissue mobilization tools. We also do things like dry needling, which all of this involves hands-on contact between the therapist and the patient. One of the next aspects of our philosophy is the exercise and education portion of the treatment. And you know, a lot of places will give you an exercise sheet, or you can look online and you can get exercises to do. But if you really don't have a good understanding of exactly what you're trying to do and maybe why you're doing it, then it's kind of hard to follow up on those exercises and to really get the best results. Our therapists work very, very closely with specifically instructing on certain exercises, and education is a part of that. We want the patients to understand why we're doing certain exercises. We want them to understand what we're trying to get out of it and what the ultimate goal is and how we progress them. It helps a lot with our home programs. You know, a lot of therapy is compliance with home exercise. And you know, we found that if people really understand what they're doing and they're a little more actively involved in their treatment process, then the results end up being much better. One of the programs we use at Peak for our post-rehab exercise is called our exercise program, which really just refers to kind of like a prescription exercise program. And what we basically are able to do is transition patients out of a rehab setting and into an independent exercise setting with some supervision and with the knowledge of how they can progress their program and prevent their injuries from happening again, along with preventing, you know, other problems that are associated with some of the higher end programs. All of the exercise programs out there have benefits, but some of the CrossFit style programs, for a lot of people, they're a little bit high level and they can cause some injuries. So what we try to do is give people the right foundation so that they can continue their exercise program at whatever level they choose to. If you go to a physician and physical therapy is part of your treatment plan, it's kind of like a prescription that you would fill at a pharmacy. You basically have a choice as to what pharmacy you want to go to fill your prescription. Physical therapy is the same way, and a lot of people, if they know somebody, if they've been to a therapy practice before and they're comfortable with it, they are able to ask the physician to, you know, to send them to that particular practice. At Peak, we want people to know who we are, and we want them to know where we are. And a lot of our business is actually repeat patients who have seen us at some time in the past, and they elect to ask the physician to come back to Peak Performance again. One of the concerns that a lot of our patients have is, how do I get to therapy? I have to come 2 or 3 days a week. Really hard to fit into a busy schedule. So what we've developed over the years at Peak is basically our extended hours, where most clinics open by 7 o'clock. We're usually treating until 6 o'clock or after a lot of times. Our locations we try to spread the locations out to make it as convenient as possible, whether you're coming from home or whether you're coming from work. We try to work in any way that we can around a person's schedule so that they're able to, you know, be as compliant with the treatment program as possible. For more information on Peak Performance Physical Therapy, you can call any one of the clinic locations. They'll be glad to give you any information that you need. You can also check us out on the web at peakphysicaltherapy.com or check out our Facebook page.
When we come back on Across Louisiana, find out how you can clean out your freezer to help the hungry. Don't miss it.